Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz. It's few days to Christmas, this 2022, and a lot of persons will be busy, very much busy this week, and even after Christmas, towards the end of the year. It's usually like that, every year, and I can't only but wish all of you, everyone that is watching, including those who are not watching that right now, that will be following the program, a very pleasant end of the year. So as a lot of persons will be traveling, please take note of the warnings and the road safety rules. Let me just remind you some of them. While you're moving on the road, of course, you keep to the left, and also of course, if you're driving, you drive on the right side of the road, and give way. If you get to a junction, please slow down. Here in Abuja, in many other places, you see people who are driving, but they are using speeds to cross the junction. It is not right. Whether you are seeing any other vehicle or not, the rule is stop. There are places you see the sign of stop. When you get there, stop. Or at the minimum, just slow. Just assume that somebody is coming from a different direction and the person could be speeding. If you are going towards a bend, slow down. The speed limit should be obeyed. On the highway, speed limit is 100 kilometers per hour, for vehicles moving so fast, and for taxis and buses and all of that, here in Nigeria is expected it should be in like 90. And when you get to commercial areas, places that is busy, there's a lot of vehicular and human movement, you should be doing 50 or less, So these are the things that help. There are many more vehicles on the way, and that's why there are higher chances of road traffic accidents and injuries. It's not because of evil spirits, like people say, spirit of accidents, I cast and bind and all of that. So a lot of these things are within our control, and make sure that you check your vehicles, they are in good condition, both the mechanical, the electrical, everything, especially if you're about to do long distance trips. The people you're traveling to meet want to meet you safe and sound, and the people you're leaving behind also want you to return safe and sound. Nigeria accounts for one of the highest rates of road traffic related deaths in the world, and is a public health issue. When people have these road traffic injuries, they are taken to hospitals. Some of them may not even have blood to transfuse. Some people bleed to death. Some cases you may not even have ambulances or vehicles that could move them in emergency situations. And when many of that happen, it stretches our struggling health system. Remember, many of our health workers have left, and so many are still living. So please, the few ones that are remaining, let's not overwork them this season. So these are just some of those tips. Please, whether you are riding on motorcycle, bicycle, and all of that, don't overspeed. Don't consume alcohol and drive, and obey all traffic or road signs that you may see along your way. Don't overtake on top of a bridge or around bends. There's so many of these tips, but I want you to have these ones because this Christmas and beyond have to be sweet. So for the conversation of today, well, not really a conversation, it's a beautiful story. Talk Health Niger, apart from this TV program that we are privileged to co-produce with Africa Independent Television, we're also using other channels to tell health stories, to sensitize communities on the need for them to help to make our hospitals work. And in the bid to make these hospitals work, they form health committees in various communities, and also these committees perform certain responsibilities as already described by relevant national policy documents. So in Ebonyi State, where we went through some communities, and we also had a radio program there that stopped some weeks ago, there were a number of success stories, and I think it's nice to bring this for everyone to see that when communities get actively involved, take ownership, of their healthcare facilities, there's usually positive results. You know, what you're about to watch is in Ebonyi State, Southeast Nigeria. You know, in every other place, whether in the north, the west, the south, anywhere, the governance structures might be different, but every community should have a health committee that should be responsible to making sure that they get the best possible quality of health, and also help to draw attention of the government institutions to do their job. Because like I always say, government has the primary responsibility to make sure that we are healthy in order to ensure that our right to life, as guaranteed by the 1999 Constitution as amended, is there. Without rights to health, there's no right to life. But also we as citizens and communities, leaders at every level, we have responsibilities. And I'm very happy with what is ongoing in some communities in Ebonyi State, and that's what we want to bring to you after this break. Do stay with us.
Really, the community is really health conscious, and we noticed the need for a committee to help us in managing the health system. That informed our decision to set a committee that can be overseeing the activities in the health center. The committee, among other committees, is about the most functional. First, they give us health information. They enlighten the populace. They mobilize the people to come for, you know, immunization and other health concern activities here.
Nde wanyi o ihe kurum oroja na aru ni bia na buri bia de nkom. Ai na roa. No to my nato. I think kodem ai jana agbale nemi.
Where the health center is situated at is a rented house. And since after your visit, we've been able to intimate the community over the development that the landlord of that house is quitting the health committee out of that health center. So as we're talking now, the house behind me is where the WDC, the committee, is now striving at the community to put into proper renovation. And if you get inside there, we have been able to do the ceiling, do the plastering. Inside the hall, there is a heap of stones ready for flooring.
Ihe agbaneme na health center, ihe omeru di otutu.
We have been experiencing that causing creeping animals to embarrassing people. Based on that, the villagers now took it upon themselves to ensure that the environment is kept in it. 2, they have been encouraging the health committee to always supervise the places to ensure that there's a health facility kept in order. And of course, last year, early this year, the community fixed zincs. The broken zincs, they were all broken bricks. They took them away, and the louvers taken away by unknown persons. The beds broken.
Na onwanyi banye dokuike. Ni na even mere hanji ya kpania ha mo ha se health center se ODC mo sa nyi nweta na nwenu na do no nve eno na eja iyo ni be ndi osa na ward oma na ward 1 ndi anwenu bụ na ndị enwo health center ya bụrụ even akwa anya na anụ mgbe aka anyị bidoro na even doka 800,000 anyị tiekwara na ya ebekwa ava anyị bịakwa bịa mee meeting nke ọnwa asatọ ma nnara even doka 1 million anyị tiekwara na ya.
From time this health center was established, it was self-help project. Even the equipping the place was a self-help project. So it has been the child of the community to have this place as you can see it now. The seats you can see inside this place was donated by the welfare of Amora And they have been assisting in providing some materials that will enable the place to function.
Mgbe ndị mmadụ na-anọga ka wa na-abịa sọ ọmụnwa n'ibie na-achọ ndị m nọga n'akwakwa debe duru n'akwa mbie mekoteka afụtakọta na ibie n'ihu ibie senta dị na-ajụ nwoke a ndị a ọdị ga onye lara n'ezinụlọ nwa ndị ọbụla nọkọta nwa n'ibie na-anọ ọ gịnị kpatara unu abịaghị na ibie ba na-amụnwa unu na-eje n'akwakwa je na-amụnwa n'ọdịghị ma asị m ma na-abịa ka wa anọ mbụ anyị kpakọtara m legi nke ihe dị na the community siwo unu bịata je bịa ba amụje nwa n'ibie n'ihe na-emeko
ife mba dị iche ndụ na ya bụ na mgbe anyị enwebụ ndị health committee na anyị ama n'ụlọ ọgụ uru ndụ n'ife a n'ọgụ ọha n'ihi na uru ndụ na ya bụ na anyị ama n'ọnya bekee na-enyeje ọgwụ se enyeje ndị obodo nọọ mgbe onwe ndị bekee nduere ha bịafute anyị bụ mgbe ha mere anyị mara na bekee na-enyeje ọgwụ se enyeje ndị ime obodo ma ndị ime ma ụmụ egerema amụrụ ọvụ ma ndị ọgaranya n'ihi na mgbe mbụ na anyị anọ n'ụwa abịaje na anyị na-eweje na ha na n'oke ọnụ anyị agbararị moto sụsọ anyị jee eka ndụ nye enu na-eje kenye naanị ọnụ anyị mgbe anyị bịa nwee kọmitii ha bịa kọwatara anyị ya eme anyị bido bịa je na health center anyị enyere anyị.
When we found out that the government cannot even carry us along, we have many MDGs in many places, but none of them is being found in Namata. They couldn't do any for us. We don't have anybody to speak for us. And it seems as if the government is forgetting the whole of Amata community, which to its importance, we were able to make it possible for us to rent a place. And we have been doing it until we come to a point where we understand that having a health committee will make a very good progress to us. And which after that, we made and we had our health committee. And since the beginning of the health committee, we have been working assiduously to make things through the work of Toko Health Niger, which brought us into a limelight. Now, we can see many progress which I have done. If you could come to our town hall, you can see the progresses that we have done.
Anyị na onwe anyị mbụ the committee. Anyị bịa na-enye na weekend very important nyere mmadụ niile. Anyị go so mba ebe and by the grace of God na one of the village heads. Anyị na the community chairman odoso anyị kwesịrị anyị na-ebe anya pasara weekend obodo. Ke chairman so samburu onye isi ndị committee. Anyị na committee ma anyị go nọkọ so anyị tuwe mega anyị isi anyị wedakwa n'iva. Because name na chana anyị no ma bụ the first one mbata ngom na chana. Anyị gba ndị mbọ so that ejikwa na anyị mbọ nke ndị ọzọ. Anyị go bịa jisi ike. Yo ndị mmadụ gọfta n'igwe. Ka anyị yọrọ ndị be nwanji ogo. Otu onye n'ime anyị mbụ the committee, mbụ ndị village committee, bụ vice chairman anyị mbụ na nwanji ogo, nnọchite anya nwanji ogo family. Anyị go ya so zugo so nwere ike inye anyị akara anyị nwere ike bido ya so ebe na ibe isi nkọta anyị yuzu a. Ba mere na anyị ji bido ekọ mana no anyị ajụna anyị ego.
The community looked at the health condition of its members and they viewed that health posts should be very close to them because as people say, health is wealth, and to build up the health consciousness of our people.
This place is a place, hall. The community uses as a hall. But when we heard of this development, Talk Health Niger, That makes us happy. And then we decided to cut part of the hall to make it a health center. And the community has accepted. We decided to contribute money to make the place conducive for patients, for the health technicians, so that we can work from here.
Kemgbe anyị nọmara ewetara anyị ozi ya n'obu nwa anyị bụ sọnsọ pọnịna o bujuru anyị na aṅụrị n'ihi na nsogbu anyị na-enwe n'ihi enwe health post do anyị iche n'ọka nkọ n'ihi na ga anyị bụgba ọnwa anyị o nwere mgbe ụfọdụ ọkachasị ndị ọgaranya anyị enwe mgbe BP ga-egbago nke mmadụ ọrụ na ọma ikwe na-egbo eji beta masị onye ọma ata mgbe n'ikwe ọma ikwe anyị kwamebe ekwe kemgbe ana anyị bụ nwa anyị na kemgbe anyị nọmara na anyị bịakwara ma bịa jikọba onwe anyị ọnụ na-asụ na maọbụdo 1 naira ma 2 naira ma anyị na-achịkọba enwe ọnụ were na-enye aka adọsọ na ọganihu.
Naanị nwere mkpa dị iche iche a gosiri nte se ha ma ebe dị ma ụmụ ife ọzọ niile ji eneta mmadụ n'ụlọ ọgwụ anyị chọrọ se ha nyere anyị aka na ya se anyị nweta anyị na-ayọ gọọmenti se ha nyere anyị aka se anyị nwetakpa ụdị ife ho.
Because here we need to have a medical doctor that will be taking care of things here, who can be coming on let's say weekly times, just 1 or 2 times in a week, or even if we have any serious issue, we can just call on them to come and help us. We need quarters, that's for the staffs, to build quarters where they can live here, because some of them comes from their place.
We, the community, try with the contribution of men and women. So, so now, on the more no ayo that you can will help. Like send will help. Menkodo in this form. I know your government, state government and federal government, they should tender justice with mercy. They will let them look into our problem.
Eka ya sumo mebihiri freezer arụsịghị ọrụ so o mezu ụfọdụ na osi n'ihe meriwo ni ka wa bịa ọrụ na ọ na-eje ma ụpata ọgwụ bịa na friji adịghị na-emewo ka wa bịa hụ ya bụrụ ibe ọ dị ihe lete ehụ ọ dị ụzọ bụ zuru nke ka ọjọọ ma mini na dibucha ụzọ onwe mgbudu mini ma onwe mgbe ji kpọọ onwe onye meje na-eme na akpọwo na osi aminede na wa magabia ta no ni dikwekwa idu onye ọbụ nyikoru elu ngakwari ya amini enyikoro elu yo bụrụ ihe na-ewuta o no wuta nkajaga na-emiera ụzọ n'ụzọ ya na-agba ma ọkọchị mudu mini arụara ya ọjọọ dị obuto maka na ihe agba ohu ma nwanyị ma nwoke na-akwekwa maka na enwe awo na-abịa every Monday aya like gị ehụ ọdị ehụ ayo onye uhu kasiri kejeje akpọ ụmụ nkeja akpọ na osi na wanogano.
I am begging Make Health Campaign team to help to government to help us. We want to develop like other communities.
Nke mbụ kachasị mkpa bụ mini anyị nwegu mini na ibie maka ọ mini nwere hụ amụrụ nwa ọnụ mini bụ ihe ji na-asaga na-asụchaga ihe then ọkụ anyị nwere ọkụ eji ọmụnwa na-eweri torchlight na-agbagharị ndị na-amụnwa ehụnwa ekwuru mbụ wo nọ m na-abịa wo na ni complain kwanụ na ọ dịghị dọkịta nọ ni ihu n'ụlọ tọgbọ ọrụ ni ihe bụ n'ụlọ I need more nurses and doctor.
So for now, our constraint is majorly on toilet because we have not dug the pit for toilet And ceiling, we have not done it. Window, we have not done it. So actually we need help from government to make sure the health center works as other health centers is working.
Aka ha mụ na-ekele ekele na-ekele unu bụ na aka je hite na unu ande unu bịara nke mbụ unu vutere ihe niile unu bịa nke ebe unu vutere bed unu vutere ihe min unu vi ihe dị iche iche vutere
Talk Health Nigeria, they opened our eyes to see some of the things we needed to have in this center, and they have made some provisions. They are too numerous for me to mention here.
When we met last year, we were able to form the various committees through the directive of the Dr. Nance as his team came to us. Really, the allogy and descriptions and adjectivization of the name given to it make our hospital work is reality. Because it's there, the lot of change for good. Our hospital development, the health post in Amata has started working to our great surprise. Because he taught us the role of the committee, the role of the community, the role of various committees that handle the health, their positions, and what they should do to make our hospital work.
Since the formation of the committee, we have been able to sensitize the people on the issue of health in collaboration with Talk Health Nigeria and other relevant agencies that have been visiting us. Since the last time you people came, it was really a morale booster because a lot of people were invited during your last visit. And when they came, it helped us in mobilizing the women, the community at large. Then the moment you people left, we hired the town crier who invited the whole community for a brief discussion on the last visit and the outcome of the last visit, which helped the health center to be a busy one of late.
Talk Health Nigeria has given us some dividends that we need here in the health center, and they have helped again to make sure that people knows about this health center. And there are many other things. Even the improvements, we have made many improvements here.
The health committee had started 10 years before now. So, but in those years back, there was nothing like Talk Health Nigeria. So if not for the last year that they came visiting us, sensitizing us, so we woke up from our slumber and said, okay, so government and even the community can assist in this. So since then, we've not been lagging behind.
The message is I have for you people is now is electioneering period. We want you people at least to talk to our politicians, the government, and public spirited individuals to help us to make sure that the health center is working. For the little ones you people have done, we thank you immensely. We are grateful.
Na akparịkọta ụka maka ahụike na makụzikwara anyị gegeji se ọrụ gị ma anyị na-ekenesi ha ike na-asọ se ha jisikwara ike n'ọrụ ha.
Those activities that you saw and the testimonials, many of them very encouraging, did not just happen. Our theory of change on this project was the fact that when citizens are educated, when community leaders have information, when they are aware of existing health policies, when they are aware of their powers, they are more likely to take actions. And when they take those actions and the results of their actions are given visibility, it motivates them to do more. Were we able to achieve that? I think the answer is yes. And what did we do on the project? We started a radio program, Talk Health Nigeria radio program, on Unity 101.5 FM Abakaliki. What were other sensitization activities? We had vehicles that went through communities, drove around communities in Ohozara and Afikpo, North local government areas of Ebonyi State, which were like our focal LGAs for this, with purpose of this intervention. They spoke in the local dialect with messages that were pre-recorded, describing the roles of communities in primary health care. The results we've got on this project is made possible by the excellent team we had in Talk Health Nigeria, as well as the highly motivated volunteers, very inspiring, highly passionate persons in Ebonyi State who lent their time without any pay, worked in their communities, and made sure that progress is achieved. At the beginning of the project, we're having weekly meetings, which later became bi-weekly meetings, utilizing technology, having Zoom calls, with hybrid meetings with the involvement of our team in Ebonyi State, brainstorming, learning lessons, as well as modifying our strategies to make sure we get the best outcomes. Welcome back to Talk Here with Hustlers, your favorite health program on television. Yes, a number of those interventions we did with support from Open Society Initiative in West Africa, OSIWA, with some funding support they provided to support logistics and the radio program that was done in Ebonyi State. And I'm really excited with what we saw. This season is when a lot of communities get to meet, especially in the eastern part of the country. Please, when you hold those meetings, ask yourself, what's the state of your primary health care? And set up committees, statutory committees, that will be reporting to the chief or the traditional head of the community or the president of the town or development unions. So, and let them be reporting back, let them be, using the World Health Systems policy of the National Primary Healthcare Development Agencies to make sure that their primary healthcare is working. Merry Christmas in advance, and thank you for watching. See you same station, same time next week. My name is Dr. Laz Eze. Bye for now.